Good evening, friends, and it's a pleasure to have you all in attention in a warm May evening. And we are so happy that you have been able to spare some time from your family life and work to be with us. So the webinar for today is going to be healthcare in times of COVID-19. How do you deliver effective healthcare while protecting yourself? And specifically, our focus today would be a guide for doctors in surgical specialties. So I would launch on into the webinar from here. Some of you, I know this is a biased group and you already feel that you are in this webinar. That means you feel that you need this. But even then, if there are some who are here because of compulsion and not by choice and are still feeling that this is not for you, I will just say the same thing which I have often said in my department, that sabka number aayega. And in fact, if you're in GTB Hospital, actually, aapka number to aa gaya hai. Let me introduce the co-panelists on the seminar who are with me. I would like to invite Dr. Sanjay Gupta, who's Director, Professor, and Head of Department of Surgery, to introduce himself and say hi to all of you.
Hello, this is Dr. Sanjay Gupta. Everyone who's listening, I think I'm looking forward to the webinar and interactive session because there are lots of queries, lots of uncertainties, and I think at least for those who are joining on behalf of surgery department, please ask questions because there are quite a few questions and we need answers to those. So I think with that, back to you, Dr. Ashish.
Absolutely. Thank you, sir. Yes, you should be asking questions, and there are several ways to ask questions. If you raise your hand in between, I will unmute you, and I would then let you speak and ask the question yourself. So at this point, I see that there is already one hand that is raised by Dr. Kesari Singh, but I will, no, he's unraised his hand, lowered his hand himself. But if you raise your hand, I will definitely ask you and invite you to speak. But you will also have the option of putting your questions in the chat or in the questions box, and then we will take up your questions depending upon how much time we have in the end or in the middle. If we find your question is relevant, I'll take it up directly. And Dr. Gupta or Dr. Asha would also be happy to answer them. I would now invite Dr. Asha to introduce herself. She is a professor of anesthesia in GTB Hospital. Dr. Asha.
How do I introduce myself? I'm in anesthesia department. I make a lot of friends with surgery department. I make them miserable too. I don't need an introduction. And I think my department knows me. Let's hope we have an interactive and very knowledgeable session. I hope I learn and impart more knowledge by the end of this.
Thank you. Yes, a lot of us don't need introduction, but somehow we live in that impression that shayad hamare ko introduction ki zarurat nahi hai, but I'm so sure that there will be so many people on this session who have not seen me or heard me before this, and I definitely do need introduction. And I myself am an associate professor of medicine at GTB Hospital, and once again, I'm so glad that you are all here. Dr. Richa, I don't see you on the attendees list, although Dr. Richa was supposed to be a panelist. Dr. Richa Agarwal from Gynae, if you were here and you could raise your hand, then I would introduce you and include you in the panelists. But on the attendees list, I don't see you signed in. However, if she comes in later, we will have her on the panel as well. Yep, cool. A lot of you might have come in with an expectation that you are going to learn something new or something amazing from this webinar. Let me disappoint you and disillusion you right here in the beginning. We are all in the same boat and we are all struggling and we are all looking for answers. So there might be so many things that you might be doing at your end on yourself to protect yourself by your own understanding. And if you have ideas and suggestions that we do not discuss in this seminar, please feel free to come up and forward them so that everybody else who is attending this webinar also makes the best use of these ideas and suggestions that you have. Do not be scared to say or come up with the suggestions and thoughts. because you never know what might protect someone from getting infected. So an overview of what we are going to do is I'm going to start off with some general information and tips. Then I would talk about the focused area of surgery in this webinar. That is the idea for today. I'll talk about some myths that are floating and prevalent among people about PPE. Then I would talk about a point, the report. Is the report sacrosanct, and what we need to do when we get the report of a patient, positive or negative. I'll talk a little bit about taking the infection home, and are you all worried or scared about taking the infection home back to family? And finally, I would take a section on once you get exposed, what happens then? What happens next? So first, let me begin with a welcome message, which has been recorded, and I will be playing the welcome message from the director himself, who's wanted to address all of you. And so let me play this message from Dr. Sunil Kumar.
Good morning, all. I am your director, Dr. Sunil Kumar speaking. I welcome you all to this class where you will be taught how to keep yourself safe while taking care of the coronavirus patients. A training cell has been constituted at GTB Hospital under the chairmanship of a great teacher, great friend of mine, Professor Piyush Gupta from the Department of Pediatrics. He is the ablest person to deal with such issues, and there are many other colleagues such as Dr. Asha Tyagi, Dr. Ashish Goyal, Dr. Maruf, Dr. Pratima. They are equally competent, they are equally good teachers, and they are equally great friends and great human beings. They are going to be part of your training, how to protect yourself while delivering the care to the suspected or confirmed coronavirus patients. As you all know, that we are passing through an pandemic rather, of COVID-19, and we know for sure that we are dealing with many suspected COVID patients who are turning out to be COVID positive later on after the investigation. So therefore, it is very important, and it's a very, very infectious disease. That also is known to all of us. Therefore, it is important to protect ourselves while we deliver the care to these patients. They are sick patients. They may not be sick patients. They may be asymptomatic, but they still require consultation or some care. And similarly, if they are very sick, they require a lot of care in terms of respiratory care, the multi-system care. And during that time, it is possible that you may be exposed to the danger of acquiring coronavirus infection to yourself. And therefore, it is important to protect yourself so that you do not carry this infection to your family, to the society, and you are able to break the chain of infection. We know that many doctors, many healthcare workers have died in the line of duty throughout the world. We don't want any harm of any kind to happen to my GTB hospital doctors, whether it is intern, whether it's a PG, whether it's a JR, whether it's a SR, or it's a faculty member or general duty medical officer. I want all of you to be safe, and safe, 100% safe. And therefore, this training cell was constituted, and they have taken out a lot of time from their routine work, their family work, from their family time, and they have taken a lot of pains to develop the methodologies, to develop the videos, to develop the talks, to tell you how to keep yourself safe. So please do learn all the things that they're going to teach you to protect yourself. They are very simple. The only thing is that you have to pay attention to all these, and you have to keep all these things in the mind to keep yourself safe. So please do learn Be interactive during the sessions. Ask your queries. They will be happy to respond to all those queries. It is important that you remain safe. You are the backbone. All of you are the backbone of GTB Hospital. GTB Hospital is very proud of you. I am very, very proud of you. I want you to be safe. Please take care. Learn everything that the training cell under the charge of Professor Piyush Gupta and other dear colleagues there will teach you. Have a wonderful time. Be safe. Take care. God bless you. Thank you and namaskar.
So with this, let's launch into the presentation and the section we go ahead. The links to the various videos that have been created for our staff members are included in the handout section in this webinar. And if you would go into the handouts, you will be able to see all the videos that have been created, and that can be used by all of you for help and assistance and reference. I see that Dr. Richa has joined. Dr. Richa, if you are here, you could share your screen and introduce yourself as a panelist while we then next go into the section on general tips. Dr. Richa, all yours.
Hello everybody. I'm Dr. Richa Agarwal, Associate Professor in the Department of Obs and Gynae.
Yeah, thank you.
And I'm glad
Dr.
to be a part of this webinar, which is quite informative for all the doctors.
Yeah, thank you, Dr. Richa. I will be bringing you in one of the future slides when we will talk about a specific focus point that you would be sharing more information on. Thank you for joining. So let's go back to the session. Again, there are some questions already. Let's see, but no sound. Fair enough. So do you think that you are at a greater risk than the general population? Most of your answers would be definitely yes. We come to the hospital, we come into a surrounding where there is more infection. Obviously, we are at a greater risk. There has been a paper in Lancet, an editorial on the March 21st Lancet, which talks about these same things and goes on to focus that, yes, it's important to protect our healthcare workers. Are you at a greater risk of complications also? Being at a greater risk for infection may not mean that you are a greater risk for complications as well. So far, whatever evidence has been accumulated, it shows that the complications depend upon your age and your comorbidity profile. If you have diabetes or associated cardiovascular disease or coronary artery disease, hypertension, yes, you are at a greater risk. If you're over 50 years of age, 60 years of age, yes, you have a greater risk. But just because you're a doctor and you're a healthcare worker does not in itself give you a greater risk of complications. There's some general advice that I have while coming to the hospital and going back from the hospital. Definitely this list is not exhaustive and you will have more and other things to add. Please go ahead and add those and use them and practice them in your regular life. But here are just a few tips that I could add and think of in while coming to the hospital. All of you know that this is a droplet infection. There is a difference between a droplet infection and aerosolized infection. Largely, this is a droplet infection. It does not spread very far from the individual because the droplets are larger in size and they suspended in the air for a longer time. So more or less, if you wear your mask carefully and appropriately, the appropriate type of mask at the appropriate time and appropriate procedure that you're performing, you should be reasonably safe. Try and avoid elevators and lifts. Most of you, if you are young and able, then please try and climb the 7 floors of the hospital that we have. Not really very many, but if you do stand in the elevators, then try and use the elevator etiquette that is available at so many different places. Should be standing facing the wall of the elevator. Wait longer if the elevator is crowded and wait for a relatively less crowded or a lonely elevator to come your way. Try and provide a blame-free environment to all your subordinates. If you provide a blame-free environment, it is more likely that they will report incidents more freely As a result, in turn, you will be at a safer situation, and every one of us will remain at a safer situation in the hospital. Again, it's always good to ask someone to observe you and give you feedback while you are doing things such as wearing your PPE, donning it, doffing it, handling your mask, going around seeing patients, using or not using hand hygiene. Sometimes हमें लगता है कि हम जो कर रहे हैं बिल्कुल सही कर रहे हैं. I'm doing it absolutely perfect. I know when to wash my hands, how to wash my hands, how to handle my mask. But there are mistakes that we all do and we are not even aware. Sometimes we may be touching our face at so many times. We have all got those tics and all have got those habits. So if you ask some of your colleagues to observe you and give you feedback, then you might actually realize that there were so many errors and fallacies which you could have corrected. And just by knowing them, you would know how to act and where to act. Another question that I have in mind, which bothers a lot of my medicine colleagues also, is referrals. So whenever you're writing a referral in medicine or to any other department, please think twice. Do we really need that referral? What are we trying to achieve by that referral? This is true for non-COVID times also, but especially in these COVID times, please be sure nobody wants to see referrals really. Unless you have really a specific question to ask of an individual, try to avoid the referral. It's a common computer jargon which says garbage in, garbage out. So if you really don't have a specific question for a referral, try and avoid it. Because the more people you are getting involved, more people you're interacting with, more people the patient is exposed to, definitely the more chances of infection you have. When you go back home, sanitize your keys, glasses, specifically glasses, wash them with soap and water, or sanitize them the way you want, and your pens. And the last among the general tips, please be sure that life without a mobile phone is possible. Please try and reduce the use of mobile phones in the patient care areas. If you're using your mobile phones in the patient care areas and it is extremely important that you need to use them, try and wrap them in a plastic bag and use them as little as possible while you are in patient care areas, because definitely the phones will have fomites sticking to them, which you will carry back home, or they cannot be sanitized appropriately and all that well. Let's come on to clinical care in COVID times, and specifically I would be focusing on outpatient areas, inpatient care areas, intensive care areas, emergency care areas, and operative care areas. In the intensive care area, I would want to bring in inputs from Dr. Tyagi, and in the operative care areas, I would also bring in inputs from Dr. Sanjay Gupta. So while working in the outpatient, whether you are in the fever clinic or in the OPD, a general advice, try and avoid the AC. Yes, it's summer, it's hot, and PPE is extremely uncomfortable. You're sweating inside. But the moment you switch on the AC, you tend to close the doors and windows. You are accumulating the virus in your environment. You don't know which patient is positive. You don't know which patient is infected. You don't know which patient has brought in the infection with him. Even if you are using the AC, try and keep the temperature at the highest tolerable level. The best would be to keep your doors open and your windows open so that there is circulation in the room. But yes, if it's too hot and uncomfortable, use the AC, keeping the temperature at the tolerable highest level. I know some of you might say that in the GTB hospital, the centralized AC is there, so you may not be able to have temperature controls, but not all outpatient rooms have centralized ACs, and you do have window ACs where you can effectively change the settings. Good circulation, like I said, keep your exhausts, keep your windows open. Use your face shields. If you don't have face shields, get them at the earliest. Mask alone will not prevent exposure. If you have a face shield, you definitely reduce the chances of getting exposed. So the hospital is providing face shields. If the hospital is not providing face shields, there are innumerable number of videos which tell you on YouTube how to make your own face shields very quickly, very simply, very effectively. So please get your face shields if they are available. If they are not, make your own face shields, but do use them in outpatient areas. Telemedicine services, although yes, we do not officially provide telemedicine services, but you have your patients who've been following up with you. Some of them may just need a simple follow-up advice. Encourage them to do audio and video calls, even if you can avoid one patient's visit to the hospital by indulging with them a little beyond required by that what is required by the call of duty. You might actually be protecting your own self. If you do not know how to use video calling and telemedicine, learn the ropes. It's not so difficult. While you're providing inpatient care, it's not really necessary to go near the patients every time unless it is absolutely needed. So think wisely, think carefully, bring in your judgment, bring in your clinical acumen, and consider which patient you need to see all the time and which patient you don't need to see all the time. Yes, you will make mistakes, but if you have thought carefully, the chances of making mistakes is lesser. If you're auscultating a patient or taking their blood pressure or giving injections or drawing samples or doing procedures, take a little care to turn their heads to the opposite side and look away from them so that they don't breathe into the same space in which you are breathing in and they are breathing out. If you plan your visits into the cubicles of the hospital while you're going in to take the patient, if you plan in your mind with a piece of paper, what are the things that you need to do when you go in, you will be able to reduce the number of visits that are required for every patient. And definitely you will, when you reduce the number of visits, you will be reducing the chance of your own exposure to these patients inside and to other people who are involved with the patients. So if you plan appropriately, you will be able to do multiple tasks in one visit to the patient rather than going back every time for a form which has not been filled or a name which has not been collected or an age which is not there and you missed it out on the first opportunity. Be on guard all the time. Don't get caught unaware. You don't know which patient is spreading infection or which patient is positive. So just don't get caught unaware and be sure and remember that anybody could infect you at any point of time. While I go on to intensive care, let me bring in Dr. Asha Tyagi here at this point of time. Dr. Asha.
Yeah. Hi. Am I audible?
Absolutely loud and clear.
Okay. Okay. See, first thing I'd like to say is that fortunately, if we kind of just look back a little, nobody, touch wood, from the anesthesia department, despite having been exposed, despite being quarantined, none of us have tested positive for COVID till now. I think this speaks volumes about probably the way we practice hygiene measures as it is. Maybe working in OTs helps us to work and live in a certain way, which has become an integral part of how we function all the time. Because for us, it is OT or ICU, and both are areas always a very high degree of asepsis and high-level disinfections which have to be followed. Having said that, there is also evidence which has been published that despite thinking that aerosolized generating procedures like intubations are going to put us at the maximum risk, thankfully, all over the world, this trend is being mirrored. That anesthetists are testing positive in the least numbers. So whatever we are doing, I think we are doing it well. Let's continue to do that. Let's not slacken. Let's keep up our guard. And also one more thing in the same context, I'd like to say that in NHS, there has been a huge audit and it is being investigated also. There are a lot of BAME, that is Black and Asian minorities are dying in healthcare workers from COVID positivity. One of the results, besides the genetic and exposures and whatever is being said, it is said that the nature of work and lack of appropriate protection that we take is the largest cause. So all of this together, I'm trying to drive in home the point that we need to protect ourselves at all times in the best way possible. In the same context, PPE, let us get it out of our heads that it means hazmat suit. It doesn't. A simple surgical mask, a simple face shield, or an N95, or an impermeable gown, gloves, simple shoe covers, everything is a PPE. Depending on the kind of work I'm doing, the kind of patient I'm dealing with, I need to choose my PPE wisely. But in this era, I always need a PPE. And in this scenario only, probably it is anesthesiologists, I think, who have been so used to wearing gloves and masks and standing at head end and taking care of disinfections that it comes more naturally to us. What PPE should we be looking at in OTs and ICUs? I think is the burning clinical question we need to address in this forum. We have guidelines which have been issued by the Ministry of Health and Family Welfare. I suggest you all go back and read that. They have been given separately for COVID and non-COVID hospitals. By definition, ours falls into a non-COVID hospital. It categorically mentions that during all surgeries and all general anesthesias, we are supposed to wear, mind you, a surgical mask, a face shield maybe, goggles, and gloves. An N95 is advocated only if you suspect the patient is from a containment zone. How I would like to interpret and kind of relay this forward is that when we say 80% of patients are going to be asymptomatic with COVID, that means for me, every patient being scheduled for a surgery is a potential suspect. So I think we need to wear our N95, face shield, goggles at all times in the OT, surgeons and anesthetists both. This should go a long way in protecting ourselves. Glove hygiene, I think we are all used to. That doesn't come as a new thing, except that please do remember you need to keep disinfecting them every time you have touched a certain surface. The second only, just one more thing that I'd like to probably emphasize here is that when we are entering COVID suspect ICUs, we are on our guard. That is not the problem, where you're wearing a full PPE, full complement PPE, along with a hooded coverall. The problem is in the so-called non-COVID hospitals. And it is here, I think, that we need to heighten our sense of trying to protect ourselves without letting the fear come in. We have to work. This is what we are trained to do. We must do it. We must look back at this time and be proud of ourselves. We must continue working, but we have to save ourselves at the same time. I think that's all I'd like to say.
Thank you. Thank you, Dr. Tyagi, for successfully putting the anesthetists at the top of the pyramid. And I'm glad that you were able to do that. So many people would be listening to this. I see there is a raised hand by Arushi Seni. Arushi, I have unmuted you. Please go ahead and ask your question. Arushi, you can unmute your mic and speak. Okay, maybe Arushi doesn't want to speak. So at this point, there are 3 questions that are coming up in the chat. I will take them up one by one. Girija Tikku says that there is no sound, but I hope that her sound issues have been resolved because others are able to hear. Dr. Bhavna asks that should we discard the face shield after one use? Now, this is a question which depends upon the type of face shield you are using. I noticed that in the hospital, there are several types of face shields that are available. Some people are using the studs face shield, which is very heavy and expensive and is of glass. So I suggest that clean this face shield with hypochlorite and alcohol-based solvents and reuse this face shield. There is no point in discarding this face shield again and again. But when you're using a lower quality face shield, which you have self-constructed at home, and you know that there are so many slide transparencies, OHP transparencies available, and you can make a shield every day, and your OHP transparency is also of a very low quality, yes, go ahead and discard it every day and use a new one. So try and reuse and save. This not only goes for the face shields. So far in GTB Hospital, we are getting a free supply of N95 masks. Please remember, world over, people are not getting N95 masks. And maybe in a few months from now, you may not be getting as many N95 masks as you're getting today. So please save for a rainy day. Try and reuse your N95 masks. I'll come to that in another section on this. There's a question by Dr. Amita Suneja. Do we need to wear gowns in the OPD? Absolutely. Why not? What prevents us from wearing gowns at all patient care areas? There are PPE available and disposable gowns or hospital gowns. Please go ahead and use them. It is definitely going to protect. We don't know which patient is going to affect or infect us. Please elaborate on centers, areas, ICU, which have only central ACs. There are no split or window ACs installed in the OTs. What to do? I already said that there is a little control that you have in the areas that are centrally air conditioned. That yes, we live in this world in 2020, so I really don't have very many answers. You can't open windows in OTs. But yes, we live like that, but we have other ways to be careful about. Is it high time we should have online reporting system? At present, Sister distributes the reports. I'm not certain what reports you are talking about, ma'am. So at some point, let me try and unmute your mic. So maybe you could elaborate specifically on what kind of reports that you are talking about. I have unmuted you now. Dr. Suneja, if you could, yes.
Yeah. So actually in OPD now it is a lockdown period, but once the lockdown period is over, we are going to have huge rush. So, and the sister distributes the lab reports. So there is a huge line at that counter. So we should work towards the point that online reporting system should be in function.
I completely agree with you. Definitely it should be in function and it should be in place. But this is a little bit beyond my paycheck. And yes, this is being recorded and definitely I'll put it across wherever I can as much as my limitation allows. So I'll hold the rest of the questions for now. We'll take them up as we go ahead in the end of the section. Let's go beyond. One other point in the intensive care that I wanted to add was that when a procedure is being done, for example, an intubation is being done or an aerosol generating procedure is being done, try that all people who are not required at that time should be out of that room. And we already have one case who was exposed exactly like this, that they were just there in the room when the intubation was done. And then you all know what happened. So coming on to operative care, and I would bring in Dr. Sanjay Gupta. Sir, mic is all yours.
The surgeons, I feel, are exposed to the risk of infection in the OPD, the indoors, emergency especially. And I just share what I have done, and you can maybe tell me what better I can do. Is that I'm asking everyone to wear N95, cover that with a surgical mask, and then use a face shield, and then try to maintain distance from the patient so that they don't crowd onto your table. And of course, hand hygiene as frequently as is required. We are also, because my worry is that we tend to concentrate too much on the patient. We completely forget that there's a relative there with the patient, and it's my fear that it's the relative who's the carrier, because the patient is by and large on the bed, not able to move, but it's the relative who's running from the ward to the juice wala and others, and he is the one. So I think we need to not only look at the patient, but all the attendants, especially the mobile ones who are there. Another area which I feel, because this was only day before yesterday that I got a lot of quarantine form from one of our surgery units, and I was going through the forms, and almost everyone said that they'd had lunch with the person who was later found to be infected. So I sort of shot off a circular, or it was more of an appeal, that please do not have your meals together, because we are used to it. That's the time when we take our masks off, and that is the time when we are most likely to infect each other. So I think, eating places are like those, what is it called, the check clearing areas where everyone meets everyone else. So I think this is it. For the operation theater, I am completely in the blank. We are just doing minimum. I keep on getting instruction from Asha as to what I should do and what I should not do. I don't think we are as yet clear. I have spoken to my colleague in the US. He was with us, Ajay Chopra, and he's working in New York in an area which is predominantly black, and they get a lot of COVID. And he says, I just wear an N95 and I cover it with surgical mask and I go ahead with my work. So I have a feeling that overdoing the PPE may not be the answer, because wearing all those overalls inside the OT by itself has a drawback. I think you can't really work comfortably. For so far as the AC is concerned, yes, we are trying to get the central AC in all the general surgery OTs and surgery emergency OT. I have spoken to an AC manufacturer that is it possible to have an AC with a high quality air purification and bacterial filter incorporated, so that as the air is getting cooled, it is also getting purified. And he said that doesn't happen. You need a separate air purifier, because the air in the cooling unit is wet, and wet air is not conducive to being clean through HEPA filter. You need a little dry air. So I think we need to sort it out. That's more of an administrative issue. But till that time, because operation is a time when you are all crowded together, your heads are together. So I think the way out is that we must sort of not get involved in surgery if we feel that we are not perfectly okay. So I would say that rather than anyone telling you or you coughing onto somebody's face, better you don't get yourself involved. So I think that is what I would suggest as of now. I think that's all I can say right now.
Thank you, sir. Definitely, I'm sure that a lot of us will take heed on that advice and take care that things are getting better. There is a question from Dr. Saurabh that should we be doing RT-PCR in all high aerosol generating surgeries? I think we are practically doing that already. After how many days should we discard the N95 mask? And there are AIMS guidelines which ask us to discard after 5 uses. This is a question by Sonakshi. So Sonakshi, that's a wonderful question. I have a section on reuse of masks, but since you've asked this question, let me take it up right here. So N95 masks, there are 2 types of masks. One are single-use masks, and most of our surgical masks, 3-ply masks that we are getting are disposable single-use masks. N95 masks, the guidelines change rapidly. So without going into that, I would say, yes, I agree. AIMS has issued guidelines that you should be keeping your masks in a brown bag or in a paper bag every day and rotating the mask after every 5th day. So you get 5 masks at one go at AIMS, and you use 1 mask, then keep it in a bag on that day, then use a fresh mask on day 2, and bring the first mask back on day 6 after you've exhausted and rotated all 5 masks. So that's one way to do it. A lot of other places, including several states in the United States of America, are just being given 1 mask, and they are told that these masks are to be reused until your mask is either visibly soiled, or 2, it is damaged or broken or gets wet or dirty. So those are the only conditions in which you are issued a new mask, and you are reusing those masks till eternity. So there are no specific points, but the only thing I will say is use them judiciously and wisely, because there may be a time soon when you may not be getting enough. Because if there is nothing in supply, then there is nothing, even if there is a higher demand. How sensitive is the infrared thermometer? Obviously, the infrared thermometers are coming from different places and of different qualities. It is not sensitive to tell you whether the patient has COVID. So it's not a test of COVID. It will tell you it is whether the patient has temperature. It just reads your body temperature from a distance. Prabhat Srivastav asks, should anesthetists use a full PPE in ophthalmologies where phaco cases are done in plenty every day and are aerosol generating procedures? The question has got the answer in itself. So I'll leave the question there. So it's kind of a leading question. Dr. Guleria is asking, what is the role of HCQ in chemoprophylaxis to all healthcare workers? And it should be emphasized. yes, officially the ICMR guideline says, the national guideline, that we should be using
Dr. Ashish, I think there's a problem with the link.
Can't hear you.
Asha? Yeah.
Sir, I
Can
can
you
hear
hear
you.
Dr.
No. I stopped wearing Ashish. Dr. Richard, you can hear that?
Ma'am, you are visible. Dr. Ashish is not.
I
I'll
think
give him a
Ashish
ring, I
has
think.
dropped off. Hanji, sir. You have to. His picture's also frozen, so either the internet has
So I think link issue.
link issue probably.
We couldn't hear you and the picture was frozen there, though we can all see and hear each other. Okay. Yeah. So, okay. So I think it's up to three of us. Dr. Richa, you have something to say about obstetrics? Your input so far as the, I think the risk is higher there. What would you say?
Yes, sir.
Dr. Ashish, you are back with us. Dr. Richa, I think you can just tell us till we get Dr. Ashish's voice back.
I was just trying to emphasize certain things, because most of the times we know what needs to be done and what should not be done, but while doing practically we forget those points. One of these is that every patient is a potential COVID positive patient, even if that patient is asymptomatic. Like that patient who was with us in SLR, she was with us for last 2 weeks and had come with postpartum eclampsia and AKI, and she was given dialysis 6-7 times, and she was completely a non-suspect for COVID. But then suddenly one day she suddenly got breathless, which was thought she might be in pulmonary edema, because she was not able to get dialysis, because dialysis OT was closed for a few days because of COVID positive patient had been dialyzed there. So the first thought which came to our mind was pulmonary edema. And then later when she was intubated, then we thought of COVID and the sample was sent, and then she turned out to be positive. So basically every patient, even if that patient is asymptomatic, should be treated as COVID positive. One thing I would like to emphasize that. And so personal protective equipment should be used for all the patients, which may vary depending upon the degree of, like if a patient is asymptomatic, N95 mask, face shield, gloves, and a gown. I would like to emphasize gown is very important. Because what happens is we tend to soil our clothes, which we are wearing the entire day, and we change them only after we reach home. But during the entire duration of the when we are in the hospital, those clothes become a source of infection for all of us, and which may get transmitted.
Sir, could I make a point? Yeah. Actually, sir, following these, I think, reporting from gynecological departments, because that's a department which never stops working, really. I mean, even in the middle of this COVID epidemic, they are having to deal with all the maternal emergencies, and the obstetric care never really stops, sir. And it's more or less an emergency care. They cannot plan and, take care of patients in an elective manner. So, sir, the recent update on personal protective equipment for healthcare workers, which has come in, has upgraded the risk for gynecologists. It says that, it is if you scan the entire document, sir, this is the only specialty which has been upgraded on the risk scale. It says intrapartum management in the labor room, has now been upgraded to the same thing as an OT or aerosolized generating procedures. So it is recommended that they need gloves, of course, and that they need their face shield, they need an N95, and of course a gown they will have to have, because you expect a lot of fluid spillage from the amniotic fluid. So their perception that obstetric care is high risk is evidence-wise also true, and there is enough data to support it. And I think we need to upgrade our PPEs for gynae and obstetric use.
I'll just like to make one. Yeah, sure, Dr. Isha, please.
So one more thing I would like to highlight, like there have been recent reports where virus has been shown to be in the peritoneal fluid also, and that too in higher basically concentration as compared to the oral secretions and nasopharyngeal secretions. There have been reports like that. So even at the time of cesarean, it is very important to wear a proper PP that should be completely water resistant, waterproof, and multi-layered. So during cesarean also proper precautions should be taken, because that becomes a very high risk, because there is a lot of amniotic fluid and blood which may tend to like permeate through the PP, through the which the surgeon is wearing at that time.
Okay. Dr. Ashish, are you back with us?
Yes, I'm right here. Thank you.
Okay. Can I just put in a few words before you take over?
Absolutely.
Yeah. So I think what I would say, one thing is that we are talking, we have all spoken about PPE and what we should do to protect ourselves. I'm not sure really whether it seems to be a little odd with what rest of the world is doing, that let everyone get infected and get immune, but not get into a morbid state. So maybe at some point or time or the other, most of us would be infected. I would say that what we also need to be concentrating on is the way that we perform our duties. Now, we are used to teaching. So first the intern sees the same patient, then the JR sees, then the PG 1, 2, 3, SR, and then in the grand round, everyone is there. And if that patient turns out to be positive, then the entire unit is off into quarantine. So I think we need to look very closely at how we perform our duties, so that in case a patient who was initially not suspected to be COVID positive, then turns out to be positive, at least only a minimum number of people go into quarantine. So I think that's an area where we need to sort of make proper protocols so that everyone reports to the, one person has 2 or 3 patients under care, reports directly to the chief, does not interact through the entire chain. I think that is important. And I'll re-emphasize that we are used to looking very hard at the patient, but we don't look at the attendant. And I think it's time we started looking at who's accompanying the patient and what that chappie is doing, rather than what's happening to the patient himself or herself. Dr. Ashish?
Yeah, thank you, sir. Thank you for your inputs. And let's move on from here. And I'll go back to the presentation again. Let me get this off. Yes. Yeah. So I'll now come on to PPE. It's been believed that yes, if you are wearing the PPE, then you are protected. But really, is that true? Are you protected if you are wearing a PPE? So let's take up some PPE myths busted. The first thing that I would like to say, if you are wearing the PPE, you are not safe. Don't think that just because you're wearing the PPE, you're going to be safe from everything. PPE does not mean the hazmat gown that has been shown so often in videos that emerge from United States or from China. PPE is just personal protective equipment, and it has got several components. It could be a mask, even a 3-ply mask is a part of your personal protective equipment. Goggles, gloves, face shields, head covers, shoe covers, your suit, everything is a part of your personal protective equipment, depending upon where you are working. This session, I'm not going to teach you how to wear a PPE, how to don a PPE, how to doff a PPE. There are so many videos which are available. Even the hospital has circulated official videos which have been made on several occasions. If you have not yet seen them, please go to YouTube and see them. Please go to Google and see them. And there are some video links which have been included in this particular webinar also. Please feel free to see those videos which have been made by the hospital specifically for this purpose. In this session, I'm not dealing with how to don and how to doff. The links are available in the webinar. Mask, again, like I said previously, use judiciously and use the right one at the right time. If you are using N95 while you are walking, probably going back in your car alone driving, and you're using an N95 and discarding it before you reach home, you are probably wasting an N95 mask, which could have saved another one of your colleagues at another time. So be careful when and where you are using which mask. So please understand there are different guidelines available by the Government of India when you need PPE and where do you need it and how much PPE you need. Get through. There are links in this webinar again to those in the handout section. Use those links and see where you need what. Again, I'm not going to go into details of how to don and how to doff. But these next two slides, I'm going definitely to talk about masks in a little more length and detail, because a lot of people are more confused in masks. And I personally also believe that it is the mask which is going to protect you and not your hazmat suit in most of the situations. Obviously, if you're doing aerosol generating intubation, then you do need to be in a full PPE. But at most of the places, if you are using a mask properly, you are generally quite protected. Is it okay to lower down your mask, let it hanging around your neck somewhere here while you're eating food? Is it okay to slip it aside while you're talking on the phone? A lot of people do is like, phone mein awaaz theek nahi ja rahi. Just slip the mask aside, leave it hanging, and then talk on the phone. How do you remove your mask? N95, do you pinch it from the top and just remove it like that? How do you reuse your mask? We just talked a little bit already on how to reuse masks. Look around while you are talking to your colleagues. See if they are wearing masks or if they are not wearing masks. Now, when I'm saying this, I don't mean of colleagues who are talking to you on a virtual space like this in a video call, but definitely when you are talking to colleagues in person, please do look around and shoot that colleague first who's not wearing a mask while talking to you. The answer to all the questions above is practically there in the question itself. They're all leading questions. Obviously, you do not lower the mask and eat your food while it's hanging in your neck. You don't leave it hanging in your neck and talk on the phone. You don't pinch it from the mask in front of you. You definitely would remove the ties at the back first while you're discarding your mask. When you remove the mask for taking tea or something to eat something, remove the lower tie first and then the upper tie. Don't touch the front side of the mask, because if you have pinched your mask and taken it off, you're probably already infected. Keep the mask inside your table drawer or on a tissue paper, front side down, very carefully. And once you have removed your mask, please wash your hands, because that's where most of the virus is. You have to practice good hygiene when touching or handling the mask. Place the mask carefully when you are tying it. Ensure that it covers your nose and your mouth and is tightly fitting across your face. Avoid touching the mask while you're working. This appears to be so simple and so useless a tip that हम इसको काफी ignore कर देते हैं. ये तो हमें मालूम है. मैं क्यों touch करूंगा अपना mask? But ask your colleague to observe you. You will realize you touch your mask at least 5 times in every minute. You want to touch your face, or you want to scratch your nose, or you want to touch your lips which have become dry, and be careful. You need to consciously avoid doing that. When you remove your mask, don't touch or pinch it in the front. After you have removed, clean your hands. Replace the mask as soon as they become dirty or damp with fluids and secretions of the patient, and discard the single-use masks after each time and dispose them off immediately. Don't keep them on your table thinking that, yes, I will discard it a little while later when I get up. अभी मेरे पैरों में बहुत दर्द हो रहा है, अभी मैं थोड़ी देर में जाके करूंगा. No, if you have removed your mask, which is a single-use mask, discard it right then and there. So I tried to put in some polls. Let me see if I have got this technology right and I can get the poll to launch. So I am going to launch the first poll, and you can answer it on your answer sheets. I have launched the poll now, and you could answer and submit. I will keep it open for a few seconds. Who do you think is most likely to pose a risk of exposure to you? I've given some choices. A patient who is COVID positive, a patient who is COVID negative, a patient whose COVID status is unknown, one of your colleagues, or one of your family. Who do you think poses the most risk to you? So we leave it open for a minute or so. And then let's see, it's already been open for 45 seconds. We will all keep it open for another 10 more seconds. We have 63% people who have already voted for this. And I will be closing the poll in another few seconds from now. And I will share with you what people had to say. Good. We had 76% votes on this poll, and it's interesting to see that a lot of people who have participated in this poll, 80% feel that it is a patient whose COVID status is unknown. But an important answer that also emerges, and 12% people have got that hit it on nail, is that you are also at risk from one of your colleagues. That's just the drive home message that I wanted to bring in through this poll. That yes, of course, it's the COVID patient whose status is unknown, but also it's your colleagues who are going to be posing the most danger. So stop those tea clubs and lunch meetings already. So now the report, although Dr. Richa has already busted the climax that I wanted to build up with the report, and but let's take up this section on the report which I had planned to place for you. I believe a negative report is a myth. It's a mirage. Be very careful of it. Treat every patient as positive. It said till, but please read it even if the person has been proven positive otherwise. If the report is negative, even then please continue to be very careful, specifically while doing your surgeries, while taking intensive care rounds, while intubating patients. Even if the COVID report is negative, you really don't know the status. There are possibilities of false negatives. We have had those in our own institution, our own residents who I know are definitely positive due to circumstantial evidence, and yet their reports have repeatedly come negative. So it is very dicey. So any report, even if proven otherwise, please be careful of every patient. A positive patient is largely harmless to you. It's just like HIV. You will never get HIV from a patient whom you know who is HIV positive. You will get it from a person whom you don't know about. And a colleague may not be so simple. It may not be so clear in that case. For the tea break, as again, it cannot be overemphasized. Don't eat in your messes and canteens. If you need to, carry the food and eat it in your room. Don't talk very much while chewing, because that's when you are generating more aerosol. Stop your tea clubs and your participatory lunches. There's another poll that I am going to launch here, and let's see, we'll keep it open for 30 seconds. Are you worried that you might be taking the infection home and carrying it to your family? A very simple poll, and I believe the answer would be not surprising. But yes, the poll is developing very surprisingly. I'll leave it on for 30 seconds, another 14 seconds to go. And we have already had 60% people have answered this poll. And I'm surprised that 4% people still feel that they're not worried at all that they are taking their infection home. I wonder who these people are, but I'm not going to go into that. But yes, all of us are at a risk of taking infection home. And definitely, I am very worried of taking the infection back home. although I live alone. That's a different matter altogether. Next is the section in which I have talked about once you are exposed, what happens next? What is the next? I'm exposed. Now that's when all panic breaks loose and everyone, goes berserk. What should I do now? What happens? I have symptoms. I have COVID. What will happen to me? I have tested positive. What happens next? This is the place where I wanted to bring in Dr. Richa again. Like, what happened with you? What happened? What did you feel? How was it when you tested positive? What was in your mind? What was going in? Yes, Dr. Richa.
Yes, sir. So thankfully, for me the symptoms were not very like much. I was only having mild symptoms. But more than symptoms, I think it is the mental stress, mental trauma, and stigmatization which one faces. Initial 3-4 days, you are worried about your family members. Since I had been staying with them for around a week, because the report of the patient came 7 days later after my exposure, that patient was positive. So next day I got my test done, but during that 7 days I was living with my family normally, so I was more worried about my kids, my husband, because I might be a source of infection for them. So thankfully they turned out to be negative. I got admitted because till then home isolation policy was not applicable, so I got myself admitted. Yes, like, thankfully, since the symptoms were mild, so physical symptoms were not a major issue. It was the mental stress, mental trauma which was more there.
Yeah.
But
Thank you so much. It's come out so often that physically अभी कोई stress बहुत ज़्यादा नहीं है. Most of our residents and doctors and healthcare workers have improved, but the mental stress is tremendous. I have another 1 minute video here, although yes, we've overshot our time. It's already past 7, but in a few more minutes, we will be closing very quickly. But I have another message from one of our residents who tested positive, and he recorded this 1 minute message for all of us, which I want to play here. Thank you, Webhav.
Hi, this is Dr. Webber. I'm a surgery resident. Even before I was handed over my test report, I was quite suspicious of having COVID-19 because of the bit of symptoms I had. And by the time my reports came, my symptoms had already started improving. But yeah, speculating is one thing and confirmation is another. And when my confirmed report was handed over to me, I was scared, terrified, and my mind was filled with all the ominous thoughts. Thankfully, the journey was not as difficult as I had first imagined, and all my symptoms improved within a week. I did not develop any complication. The anosmia did trouble me initially, but it's going to be a month now, and much of it has improved. The most important factor which helped me tide over this crisis was the support of my friends, family, and teachers, and without them, it won't have been possible to spend 17 days in complete isolation without any human contact. For me, more than the physical discomfort was the mental anguish that troubled me. And a large part of it was relieved when I came to know that all my contacts had tested negative. On a positive note, this disease did teach me a lot about my priorities in life and made me realize the worth of all that life has given me. I would like to say that until we have a drug therapy or a vaccine, we are left with our immune system to deal with this menace, and to keep it strong, we must keep positive thoughts in our mind at all times. Thank you.
Absolutely. That is one thing that I can definitely vouch for. While I was talking constantly with Vaibhav every day when he was quarantined, he was extremely positive right from day one. I sometimes felt that I am more anxious and stressing out than actually he handled it pretty well. Thank you. Let's go on further from here, and that's my final slide of the take-home messages that I want to bring to you. Yes, अगर आपको लगता है आपका नंबर अभी नहीं आया है तो ये सबका नंबर आएगा once we are all going to get there slowly. Minimize phone use in patient care areas, hand hygiene after you remove your mask, face shields and eye protection in the OPD. Take care and think about circulation in those areas and exhaust. Plan your patient visits when you're taking inpatient care, and try and minimize the number of visits that you need and minimize contact. The more you plan, the better you will be able to execute. When aerosol generating procedures are being done, just stay out. If you are wearing a PPE, you're still not safe. The negative report is nothing but an OSS, which is just like a mirage. Stop those two breaks. If you're exposed, stay calm and officially approach the quarantine committee and ask them for a quarantine, and they will look into your cases. With this, I come to an end of the presentation part of the webinar, and let's take up some questions. If you wish to stay on, please continue to stay with us. And those who would like to leave are welcome. I would just pick up one question by question, and we will take up. Nitish Kumar asks, is there something planned to manage the patients in the OPD? Majority of the patients do not follow basic precautions like social distancing, cover nose or mouth. As the lockdown eases, there will be a much larger inflow of patients in the OPD and emergency. This situation is very fluid. We really don't know how things are going to turn out. Although there was some talk today of our hospital turning into a fully COVID facility, but sooner or later we are going to be a COVID facility, as every other hospital in the city is going to be. This is my personal opinion, although there is no official communication on it. So this is a very, very fluid situation. Har roz there will be a new order from different areas, and we really don't know how it is going to evolve. Will the OPD numbers be limited when the lockdown is over? Arushi, no, I don't think there is going to be anything like that, but it all depends upon what will be our status, which is also again very fluid, as I said in the previous one. There are some questions which are omitting. I really don't know what answers to give to them or how to take them up. And some are repetitions, so I'm not taking them up. So Pallavi is asking, should we use impermeable gown in OT instead of cloth gowns? So ideally, yes, because you are protecting against spills and fluids. If your gown is permeable, there is practically no way you are going to get protected yourself in that.
Can I say something, Dr. Ashish?
Yes, sir, please.
I would just clarify on what she's asking. You can't wear a polythene gown that's completely impermeable, but you can't do anything if you are wearing a polythene gown. So there are certain of these non-woven cotton, non-woven cloth gowns which are impermeable to fluid, but they will let the skin breathe. So I think it's basically, it's not that you just pick up any disposable gown or a PP and it's a good one. There are standards to it which you can't detect by just looking at it. So there are agencies which certify it, and you must get a gown which is impermeable to fluid, but lets your skin breathe. So I think if you just wear pure plastic, then you would be in great trouble, even though you are safe. That's what I'll say.
Yep, absolutely. Thank you, sir, for butting in on that, because I was making a mess of the answer myself. Let me now ask some of the people who have raised their hands to come up and speak instead of making it more monotonous. Dr. Kesari Singh, आपने पहले भी हाथ उठाया था, अभी भी there is a hand against your name. So I have unmuted your mic. Please go ahead and try and speak if it is possible at your end. I don't think it's working. But there is another question by Ramchandra Kafle. So you want to speak? Your mic is unmuted. Fair enough, no problem. We'll go on to the questions again. I'll take up the questions. Sambhav says that it's high time we should start our own RT-PCR facility. Yes, that process is already underway, and we are developing the lab in our microbiology department, which should be functional soon, and hopefully we will be solving the problem of these reports for some time to come. Charanjit Singh asks a very important question. Is it advisable to wash N95 masks and reuse them? Definitely not. The moment you wash them, you destroy the mask. No microwave, no OTG, no vacuum cleaning, no washing, no soaping, nothing. So please don't try all those. Sambhav has got another question. Does the presence of virus in the peritoneal fluid also mean that general surgeons use PP for all laparotomies? I think that question has been taken care of already adequately in the previous discussion. Dr. Gupta, would you like to add another word on that?
I need to see these reports. I think some of these reports which are getting published, we can't take them as the final word, though if they have detected some virus, I'm sure it would be there as well. We need to protect ourselves when we are dealing with either body fluids of any kind, or in surgical specialties, you have a lot of smoke generation. That again is a way in which the viruses can disseminate. So I think, yes, you need to be a little extra careful. Today itself, I was discussing with one of my old senior residents. He had rung me up to find out what we are doing to take care of the laparoscopy gases, and I said we are not doing laparoscopy, but I think we need to come up with innovative solutions. This is the time for the bright brains which are there as to how to take care or how to minimize the risk during surgery. I have a couple of ideas myself, but this is not the place to discuss them. But I am sure, because we are not sure how you can do so many general surgical procedures safely and without too much of equipment or too much of cost. So I think that the final word needs to be said there.
Absolutely. Thank you. I have unmuted Pratishtha Tanwar. You had raised your hand. Please unmute your mic and speak. Sambhav, I have unmuted you. Please go ahead and speak after Pratishtha finishes.
Hello, sir. Sir, can we put our mask under the sunlight? As some articles say about this, that sunlight can sterilize your mask up to some extent, so that we can use our N95 mask to the next day, or we can use N95 mask for 4 to 5 days.
So again, there is too much literature on the internet, which will confuse you most of the time. The guidelines available so far and the evidence available so far says that sunlight has got no additional benefit. I would not be able to answer beyond that at this point of time before further evidence emerges. So at the moment, whatever evidence is available, you just dry them. How you dry them is irrelevant. Sunlight, please, if you are doing that in sunlight, please make sure that you are placing it at a place where it is not infected.
Sure, sir.
Shall I chip in, Dr. Ashish?
Yes, sir. Yes, sir.
The ultraviolet part of the sunlight is being used, and now IIT and other DRDO is developing, quick sanitizing chambers. So basically, ultraviolet rays at a very high dose are being given. Ultraviolet rays are used usually in the food processing industry to keep the area sterile, but they are at a very low concentration. What is being developed is very high level ultraviolet rays, but they will only sanitize the surface. If the bacteria has gone inside the N95, then I think the only way is to let it dry out so that the bacteria, so if you let 4 or 5 days, it is not just ultraviolet rays, but it is the drying of the mask so that the bacteria ultimately dies out. So I think that's it. So ultraviolet or sunlight will only sanitize the surface, not the depth.
Yes. So the only effective measure that has been shown so far is the hydrogen peroxide chambers, aerosolized, and masks put into them. But definitely we will not be having those in the near future in our hospital. Sambhav, would you like to say something?
So I was going to ask the very same question that Sanjay sir has already answered. I was going to ask about the role of UVC in sterilization of the masks. So it has already been answered. Thank you, sir.
Thank you. Sanjeevni says that at the completion of duty, doctors should shower and change before they go home. Absolutely right. And if you use your duty rooms, please do that. And there is no doubt that you should not be doing that. Now there are too many questions coming up. I will just pick up something at random. Please stop sending questions. We would like to close this. Whatever has come till Rupali Raj, I'm going to address. Uske baad jo aayenge, we will just hold on to them. Can we wash our N95 mask? We've dealt with it. No. How does keeping an N95 bag? There are questions regarding the permeability of PPE. I'm not taking them up. This is a very, very interesting question. I'm not going to name the person, but I'm opening it. It really needs to be addressed. After recovery, do I still need to quarantine if I get exposed to another case in the future? Any thoughts on that from any of the panelists? I see Dr. Asha smiling. Why don't you take that up while I read the other questions?
I think my smile has more to do with the fact that none of us will be really able to answer that with evidence. We can conjecture, we can hypothesize, we can assume relationships with MERS and SARS and COVID. We don't know the answer as yet. We don't even know about the antibody response, which is the precise reason why the rapid test kits also actually never took off. So at the moment, we don't know. Evidence-wise, we don't know. And so, there is no clear policy on it either.
Yes, Richard.
But what I have read, like, it seems it has multiple, this virus is mutating fast, it has multiple mutants. So in that case, a person who is exposed one still carries the risk of getting infected from some other strain.
Yes, so again, that's what we don't have any evidence to answer. So what the public health model that is being followed or that is being used to answer these questions is the SIR model. SIR model means you have a group of susceptibles, you have a group of infective, and you have the group of recovered. So our entire assumption at this moment is based on the fact that those who have recovered are immune and not infective. That's all I will say. I don't know if the model will stand. It's still being tested, but I don't want to put panic to come in on this. But that is the model that we are using currently.
Yeah, and as you said yourself, Ashish, at the moment that it is an assumption. So only time will kind of help us to sort this out. We should hope for the best, yes. We should hope for the best.
Right. Somebody asked when is the next session. So next session is Thursday, but most of it would be the repetition. I would be using the same slides. All the focus on Thursday would be for medical specialties and physicians and non-physicians running in OPD. The next session is Thursday at the same time. There are some other questions. Yes.
Could I just make a small comment?
Yes.
Because I think right now we have a lot of residents probably from surgical specialties who must be doing emergency intubation. I just want to emphasize one thing, that when you are doing intubations in wards, they are very different from intubations which anesthesia people are trying to do in OT. We do it in a planned manner. We keep teaching our residents this all the time. I just want to emphasize one thing. When you intubate, try and make sure that your patients do not cough and buck during the intubation. Please make sure that you spend 2-3 minutes longer, but sedate your patients adequately. Because the velocity with which a coughing and bucking patient is going to generate an aerosol for residents trying to do this in the ward will be much higher than what a passive, adequately prepared and paralyzed patient in the OT does. In all possibilities, they never buck. They shouldn't be bucking after an adequate anesthesia. So please do try and be careful and change your practice a little. Don't let them struggle during the intubation at all. Use larger doses of diazepam, use midazolam, whatever you have. You're intubating anyway. Don't be scared about the respiratory depression. That was all I wanted to say.
Thank you, Dr. Asha. Then Isha is asking, can we spray and sanitize the mask before storing for another use? No, I already took that up. No, you should not do that. One question by Rupali Raj is, what are the warning signs for resampling, though previous report may have tested negative? So the warning signs for testing again would be: one, that the patient becomes symptomatic; two, the patient develops new symptoms which were not present earlier; three, the patient deteriorates despite adequate treatment; four, the patient does not improve as you would have expected the patient to improve with your medication. Four. And five, definitely we are seeing so many patients, they come up for something else, they remain in the hospital, do not get well, we find an x-ray shows pneumonia, we test them and they are positive. So that should take care of that question. Should I continue taking HCQS prophylaxis if already started? Yes, please do. What makes you stop? There is no reason to think otherwise that it will not help. Although this question has just come up, I'm taking this up because I have not read this yet. It seems that it needs attention. Sir, I'm a day scholar and become freaked out that I may unknowingly transmit disease to my parents at home. What precautions should I be taking before entering home? You should be taking a bath in the hospital if possible. If you are not taking a bath in your duty rooms, then go get rid of your clothes, get into a bath properly before you go in. But then my point is that it's not just the time that you are going in that is important. What you are carrying outside on your clothes and on your body you can shed, but what you are carrying inside you cannot shed. So your care should be throughout the day, and your guard should be up throughout the day, and not just at the time when you're entering the home. I think we will stop questions, and I think we should call it a day. We've been going on for so long now. I would open it again back to the panelists. If you have any closing remarks, then up to you. Dr. Richa?
I would just say one thing, ki every patient, universal precaution should be taken in all the patients, irrespective of whatever the test report says, even if it is negative, then also.
Thank you. Dr. Asha?
I'm good. I think it was a very interactive and lively session. Thank you, Ashish. Thank you, everybody. Good day, sir.
Dr. Sanjay? Dr. Sanjay?
Yeah, thanks a lot. That was great.
Thank you. Thank you, everyone. And thank you for staying with us. 92 of you were still here. We had a highest point attendance of 172 at one point. Thank you. Thank you. It was amazing.
Thank you.
Thank you. Goodbye.
Good night.